Sepsis is the body's toxic response to any type of infection. Sepsis occurs when chemicals released into the bloodstream to fight an infection trigger an inflammatory response throughout the body. This inflammatory response can lead to organ damage and, if left untreated, death of the patient. The most common sites of infection leading to sepsis are lung, urinary tract, abdominal, skin, or soft tissue. We are all at risk of developing sepsis, but some people are more vulnerable than others. Those most at risk are the very young, the very old, those with long-term conditions, pregnant women, and people with lowered immune systems. Every year in the UK, 260,000 people develop sepsis and 52,000 people die of sepsis.
Hi, my name's Julie Gilbert. I work as a community staff nurse in the community, and I'm here today to share our family story about my son. 14 years ago, we were just an ordinary family. We'd mortgaged ourselves up to the hilt, just moved. Luke had passed to go in the Navy as an artificer, and he developed a lump in his groin. And the doctor said it was a hernia, and I badgered him, to go to the doctors to get it checked out, which he did, and then the doctor did blood tests for glandular fever, and she spoke to my husband saying that Luke's glandular fever test had come back negative. I was working at the time on haematology and oncology, and when my husband told me this, that they'd called Luke in for blood tests, I suspected there was something wrong, never thinking it would be cancer. Luke then had all the chemotherapy and he was doing really well. He couldn't go in the Navy because he'd got cancer, so he started to do a law degree at Leeds University. But then a lump appeared in his neck, and obviously he'd relapsed again. So because he'd missed so much time from university, he had to give up that dream as well. He then went sailing with the Teenage Cancer Trust and went with the Ellen MacArthur Cancer Trust and became a volunteer. All in all, he relapsed 4 times. The last time, his sister was a complete perfect match, so she gave her stem cells that Luke had. In June 2016, Luke was admitted for having high CMV levels. He was in hospital for 6 weeks. During the last 3 weeks, he's had a temperature of 42. He was confused. He had a rash, and I said to the hospital staff, I'm quite concerned. You're not getting his temperature under control. He was having really bad rigors to the extent that he was having pethidine to control the pain for the rigors. And I was frequently told by the hospital staff that my role wasn't a nurse, my role was a mother, and they were doing everything they could. Luke then managed to get home, where he was having follow-ups at the day clinic for platelets and blood transfusions, and had a clinic appointment on the Friday to see what the next step would be. He went on the Wednesday and had blood and platelets, and he was due at the clinic on Friday that we were all going to go and see the consultant, and he wasn't well enough to get dressed. Me and my husband went round to his house and got him dressed and transported him to the hospital, where it was evident that he really wasn't well. They got him a bed on the day unit, and the consultant came and admitted him. He was adamant that me and my husband kept his clinic appointment, which we did, and they were talking about doing a further biopsy. Still at this time had a temperature of 42, he had a mottled rash on his skin and was really confused. but they said that all he needed was some blood because his HB levels were down. So we got him settled on the ward and left him because he had settled and he seemed okay. And the staff said, he would be fine. His fiancée stayed with him. So we went home, and at 3 o'clock in the morning, the ward staff phoned us to say that he was struggling with his breathing, and they were going to take him up to HDU. So I got there at 4 o'clock in the morning, and Luke seemed okay. He was making jokes about the CPAP that he had on, because it's like an astronaut helmet, and saying, "Take me to your leader," and he seemed settled. But after seeing him, I thought he's in the best place. They know what they're doing, and I said, "Right, I'm going to go home and have a shower, and I'll come back." I'd just been home half an hour, and we got a phone call that the SHO and the consultant wanted to see us. I remember being sat in the car park at the hospital, being quite upset because I knew what was coming. We went in, and the consultant said that he'd got sepsis, and we then had to discuss do not resuscitate, and Luke was transferred back up to one of the wards because it was very noisy in HDU. Luke passed away, and on his death certificate it stated chest sepsis, which I feel could have been avoided. All the signs were there and it wasn't acted on. Luke was 29, and that was 27th of August 2016.
80% of sepsis cases begin at home. If caught in time, sepsis is treatable, and it is important all healthcare workers know the symptoms to watch out for. Your patient may complain of one or a combination of the following symptoms. They may be shivering, have a temperature or feel very cold, have extreme pain or discomfort. Their skin may be pale or discoloured. They may be sleepy, difficult to rouse or confused. They may say to you, "I feel like I might die," and have shortness of breath. Ask yourself, could this be sepsis? Thank you for watching.